Hello everyone, this video is for a P3 or a P4 year student, and the whole purpose of this video is to get you guys familiar with how to log your interventions in using eValue's pxdx function. Let's say you're on your internal medicine rotation and a 55-year-old white male was taking metformin 500 milligrams ER version at home, and they're getting put on regular version when they're in hospital. You recognize that this is an error during the medication reconciliation, and you talk to your preceptor and resident and get them back on ER version. Excellent job! You have identified an intervention and helped this patient avoid possible GI irritation. What's next? If you don't document this, guess what? It never happened. So let's document it. Log into eValue, click on pxdx, add new, select the date when it happened, select your rotation when it happened, select the site where this happened, your preceptor, patient's age, patient's gender, patient's ethnicity or race, the kinds of drugs that were involved, who did you talk to, and briefly describe what happened. So in the future, when your preceptor goes in to approve this, or you need to go back to this, you kind of know what happened. You need to select who identified the intervention. You need to say what the prescriber did. They accepted the recommendation as it is. Patient response wasn't really indicated. When we go to clinical activities, we can select multiple things. Just select one, hit control, and select multiple things. Or you can filter and search. You can say wrong. Since wrong formulation is not here, I'm going to go to next best thing and say it was a wrong drug. Performed this by myself. It took me 10 minutes from identifying it to tracking all the residents down and explaining it to them and getting it changed. Again, briefly mention what happened just so you know and your preceptor knows what you're talking about. Very important, click on Add Clinical Activity and Save Record. You have now recorded your intervention. Let's say there was something wrong with it, your preceptor wanted to modify, or you wanted to review how many interventions you've done so far. You're going to click on Review. Select the dates and click Next. In this case, my intervention is already showing up here. Let's say my preceptor said, you know what, the patient, it's not really a wrong drug, or something that your preceptor wants you to modify, or it didn't really take you 10 minutes, it only took you 6 minutes, or whatever, or it took you longer. In order to modify that, just go down the list, select everything that is not already selected. Wrong drug. It took me a little bit longer, that's fine. And briefly explaining what happened. Very important, get rid of the old one, and now you have the new one. It took me 20 minutes to identify and whatnot. And after you save record, you're done. Now you learned how to log your intervention in, and if there is a problem or you want to review them, how to go back to them. Very well done. And this is it for this video. Enjoy your rotations, pick wisely, and work smart, not hard.